Hey everyone, and welcome back. We love to dig deep into all things diabetes here, and today, we're focusing on a complication that you might not hear about as often.
Yeah,
It's called cellulitis.
that's right.
And before we go any further, I do want to make sure we're all on the same page, because this isn't about cellulite, that's a whole other thing.
Right, totally different. Cellulitis.
We're talking about a bacterial infection.
Yes, a bacterial infection that gets into the deeper layers of your skin.
And it could be really serious, especially for anyone with diabetes.
Definitely.
So today we're going on a deep dive to answer the big questions, like why are diabetics more at risk for cellulitis? How can you recognize the warning signs early on? And what steps can you take to protect yourself?
Yeah, and it's not just about a weakened immune system. There's a lot more to the story than that.
Yeah, I'm ready to get into it. What makes diabetics so much more susceptible to cellulitis in the first place?
Well, think of it like this. Your body's defenses against infection are kind of like a castle wall, right? And unfortunately, diabetes weakens those defenses in a few key ways. First, high blood sugar actually makes it harder for your white blood cells to fight off those invading bacteria.
Oh, wow. So it's like sending your soldiers into battle with, I don't know, dull swords or something.
Exactly. They're just not as effective at fighting off the infection. And then there's peripheral neuropathy, which many people with diabetes experience. This means they lose sensation in their feet and legs, so they might have a cut or a blister and not even realize it. That open wound becomes an entry point for bacteria.
So it's like a breach in your castle wall that you don't even know is there.
Exactly. And then to make matters even worse, diabetes often leads to poor circulation, especially in the extremities, which makes it harder for your body to deliver those healing cells and infection-fighting agents to the areas that need them the most.
So we've got the immune response being hampered by high blood sugar. We've got neuropathy masking injuries and poor circulation slowing down healing. Are there any other factors that up the risk of cellulitis for diabetics?
Unfortunately, yes, diabetes just makes you more prone to skin problems in general,
Mm.
like dryness, cracking,
Hmm.
and even fungal infections, like athlete's foot.
Right,
And
right.
those might seem like minor annoyances, but they can create those little openings for bacteria to sneak in.
Yeah. And I imagine those diabetic foot ulcers are a major concern too, right?
Oh, absolutely. Even a small ulcer can quickly escalate into a very serious case of cellulitis, and it can go really deep, sometimes even reaching the bone.
Wow. Well, it sounds like early detection is definitely going to be key here.
Oh, for sure.
So what are the red flags that someone with diabetes should be watching out for? What are the signs of cellulitis?
Well, the classic signs are redness, swelling, and warmth in the area where the infection is.
Okay.
It'll often feel painful and tender to the touch.
Well,
And then as the infection spreads, you might get a fever, chills, or start sweating.
and what about like blisters or pus? Are those pretty clear signs too?
Oh, yeah, absolutely. And also look out for skin that feels tight, from the swelling.
Hmm.
But the bottom line is this. If you have diabetes and you experience any of these symptoms, you need to get medical attention right away.
Yeah, don't
Then
wait.
don't mess around with this because it can progress really quickly.
So we established that people with diabetes are more likely to get cellulitis and that spotting it early is crucial. But what makes it so dangerous, specifically for people with diabetes? Like, how is it different from cellulitis in someone who doesn't have diabetes?
Well, one big difference is the delayed healing that we talked about. Because of the compromised circulation and immune response, even small wounds can become big infections.
Makes sense.
And the potential complications are also way more severe.
Yeah, how so?
Well, for one, cellulitis in people with diabetes is much more likely to spread beyond the skin and get into your bloodstream and lymph nodes. And that can lead to sepsis, which is a life-threatening condition.
Oh, wow, that's serious. Are there any other complications we should be aware of?
Yeah, so it can also lead to abscesses, which are basically painful pockets of pus that sometimes need to be drained.
Yeah.
And then in really rare cases, it can even progress to something called necrotizing fasciitis.
Oh, necrotizing fasciitis. That sounds scary. What is that exactly?
It's a rare but very aggressive infection that basically destroys the soft tissue really quickly. It's often called the flesh-eating disease,
Mm.
and you need to treat it right away to survive.
Wow. Okay, so the stakes are high.
Yeah.
Now, once a doctor suspects cellulitis, how do they actually go about diagnosing it?
Usually just by looking at it, checking for those classic signs we talked about, the redness, the swelling, and if it's tender.
Right.
But sometimes, especially more complicated cases, they might order blood tests to look for signs of infection or take a sample from the infected area to figure out exactly what type of bacteria is causing it.
And that helps determine the right course of treatment, right?
Exactly, especially when it comes to choosing the right antibiotics.
So let's talk about treatment. What's the plan of attack when it comes to tackling cellulitis, especially in someone who has diabetes? So antibiotics, I'm guessing those are the main weapon here?
Yeah, pretty much. If it's caught early enough, oral antibiotics might do the trick.
Okay.
But if it's more serious, especially with diabetes in the mix, you'll probably need intravenous antibiotics.
And that's to deliver a higher dose, basically.
Yeah, stronger dose, more targeted too. And of course, careful wound care is really important, especially if there's an open sore involved.
Right. Got to keep everything clean.
Exactly. You want to keep it clean, dress properly, help it heal, and prevent any more problems.
What about that swelling we talked about? Any way to manage that?
Elevating the affected limb can help a lot.
Okay.
It reduces swelling and helps get the blood flowing to that area, which helps it heal faster.
Right. Makes sense. I imagine pain management's a big factor, too.
Oh, definitely. Cellulitis can be really painful. You might just need over-the-counter pain meds like ibuprofen or acetaminophen, but sometimes the doctor will prescribe something stronger just to make you more comfortable while you're healing.
And sometimes it's serious enough to need a hospital stay, right?
Yeah, if it's spreading quickly or causing complications, you'll probably need to go to the hospital.
That makes sense.
They can keep a close eye on you there, give you IV antibiotics and other supportive care.
And I think you mentioned earlier that sometimes surgery is even needed, right?
Yeah, in rare cases, like if there's an abscess that needs draining or if the tissue starts to die, surgery might be the only option. But honestly, with prompt treatment, you can usually avoid getting to that point.
So we've talked about the risks, the symptoms, the diagnosis, the treatment. But I think what everyone really wants to know is how to prevent this thing, especially if you have diabetes.
Prevention is so important, and it's all about taking charge of your health and being proactive. And it all starts with keeping your blood sugar under control.
Right. That seems to be the foundation for so much when it comes to diabetes.
Absolutely. It's like the bedrock of preventing any kind of infection, not just cellulitis.
So it's not just avoiding those really high spikes and lows in blood sugar. It's more about keeping things stable so infections can't take hold.
That's it. When your blood sugar's steady, your immune system can actually do its job, and your body can heal properly.
It's like making sure those castle walls are strong, right?
Exactly. So besides keeping those blood sugar levels in check, another important thing is to check your skin every day, especially your feet and legs.
Makes sense. You need to know what's normal so you can spot any changes.
Yeah, and remember that neuropathy can mask pain, so you might not feel a cut or blister.
Right, so you have to be extra vigilant.
Be your own detective. Look for any breaks in the skin, redness, swelling, warmth, anything that's different. Even a tiny scratch can become a problem.
Okay, daily skin checks, got it. What about hygiene? What role does that play?
Oh, huge role. Good hygiene is like your secret weapon against infection. Wash your feet every day with warm water and mild soap.
And dry them well, right?
Thoroughly, especially between the toes. You don't want any moisture hanging out there. That's just asking for trouble. And moisturizing is important too because dry skin can crack and let bacteria in.
Right, so wash, dry, moisturize. What about footwear? Is that important too?
Absolutely. You want comfortable shoes that fit well.
Okay.
Shoes that are too tight can cause blisters, and shoes that are too loose can rub and create sores. And speaking of sores,
No going barefoot, even just around the house.
even just in the mailbox, you want to protect your feet, create a barrier. Even a little scratch can become a big problem.
Okay, so say you do get a cut. Despite your best efforts, what should you do?
Treat it right away,
Mm.
wash it, put some antiseptic on it, cover it with a bandage, and watch it carefully.
And if it looks infected, head straight to the doctor.
Yes, exactly. And one more thing. If you have other skin conditions, like athlete's foot or eczema, it's really important to keep those under control.
Right. It can make your skin weaker and more vulnerable to cellulitis.
So overall skin health is really important.
It all comes down to creating an environment where bacteria can't thrive and making sure your body can fight back if they do.
Okay, so we've learned a lot today. The risks, the symptoms, the diagnosis, the treatment, and of course, all the things you can do to prevent cellulitis, especially if you're diabetic. It's a lot to take in, but what's the key message for our listeners?
I think the main takeaway is that while cellulitis is a risk for anyone, it can be especially dangerous for people with diabetes.
Right.
But the good news is, if you're aware of the risks and take the right steps to protect yourself, you can greatly reduce your chances of getting it.
And that's what we're all about here on the Deep Dive, right? Giving you the tools and information to take control of your health.
That's right.
Now, before we wrap up, I'd love to hear any final thoughts you have about everything we've discussed. Well, we've talked a lot about the physical things you can do to prevent cellulitis, like managing your blood sugar, checking your skin, good hygiene, all that. But there's another piece to this puzzle, and it's mental.
Oh, a mental aspect. Tell me more.
It's about awareness, really,
Hmm.
having a connection with your body, being in tune with how your skin feels,
Yeah.
especially if you have diabetes. You've got to pay attention to those changes, those little cues your body's giving you.
So it's like listening to your body before it has to yell, right? Noticing those early warning signs.
Exactly. And then doing something about it before it turns into something serious. Being your own health advocate.
Right, because nobody knows your body better than you do.
That's right. If something feels off, don't just ignore it.
I love that. It's not just about following a set of rules, it's about really understanding your body and how diabetes impacts your skin.
Absolutely.
Yeah.
Knowledge is power, but you got to use it.
Well said. So we've reached the end of our deep dive into cellulitis and diabetes. We've learned why it's such a risk, how to recognize the signs, and, most importantly, how to prevent it.
And remember, even though this deep dive is over, your journey to better health isn't.
That's right.
Stay curious, stay informed, and keep taking care of yourself.
Absolutely. Take what you've learned today and use it to make the best choices for your health. Until next time, keep on diving deep.